Welcome to Dr. Duncan show. Today's show we're gonna show you how an adjustment can really take place and how it takes place. So we have our patient here, and basically this young man is a kid, and so for kids we use a little different techniques. And so one of the things we use for little kids is called activator. And this instrument here, it's a click like this. And what this does actually, it drives impulses to the body that kind of runs faster than the pain waves in the body. And that might be a little technical, but I just wanted to make sure you understand. And so by using this little activator, we are able to align the spine and keep the stability in the system and take the interference in the nervous system. And so what we're going to do is, first of all, I'm going to have the patient facing down. So I want you to face down for me. And put your hands right in there. Are you comfortable? Mm-hmm. You always want to make sure your patient is comfortable, and that becomes important. We want to make sure the legs are in good position, everything looking pretty good. And one of the things actually we start with by alignment is to look at the length, to see whether the legs are in, they are the same length. And when I look at this length, these feet, I can see the feet. One foot is a little longer than the other one. So in this case, we have the left foot a little longer than the right foot. And so when we see that, that means there's some imbalance in the nervous system. And that imbalance could be caused because of subluxation or misalignment for that matter. And so what I'm going to do is, after this, just checking that, I'm going to go and palpate in the spine, starting from the neck, and I will be palpating to see where the areas of the pressure is in the spine. And so we start with the neck. I'm just going to check something, palpate in the neck, and feel whether there are some areas that are full of stress. And I can feel right in there. Do you feel right in there? Mm-hmm. Yes. You feel a little tender when I touch it, isn't it? Mm-hmm. So that means that's an area of stress. I'm basically palpating the vertebrae as I go down the spinal column, and I can tell right in that area there's a little stress in the vertebra there. You feel right in there? Mm-hmm. One of the ways we can tell the stress in the vertebrae is we look for tenderness, and when you palpate, you can always hear the patient tell you that that is a tight area, there's tenderness there as we go through the spine there. And you can tell there's another tenderness right in there. You feel right in there? Mm-hmm. Yes. And you can always tell the patient is actually telling me what I'm feeling. It's all this communication between what I'm feeling and what the patient is going through in the spine. And so you can tell there's another tightness there. You feel that muscle? Mm-hmm. His dorsals are very, very tight there. And so that is something that we're going to address as we check this. And you can tell that we always look at SI joint. These joints are very important, especially for kids that are, in sports active, because what happens is the SI joint tighten up. And for you to run effectively and to be able to do things effectively, especially walking, we want to make sure those SI joints are not tender and are not tight. You can feel that is tight there. You feel right in there? Mm-hmm. Yes. And so looking at the spine as a whole, now at this point, now we can actually start doing other things. And another thing I'm going to want to do is to look at the integrity of the tailbone. To look at the integrity of the tailbone is the little bone right down here. We look at the way, if the patient lifts the legs, we can see whether there is balance between this leg and this leg. So that's going to be the next thing we want to see. So what we're going to do is look at the integrity of the SI joints. And I'm going to have you lift your legs up straight without bending the knee. Lift your leg up a little more. Is that all you can do? Okay, that's good. The other leg, let's see. You see that? That's all you can do? So one thing we are seeing is actually this leg is a little tighter than this leg. But just remember, when I was checking him, I remember telling you that this side of the SI joint was tighter than this. And that has been indicated by the way his ability to lift the legs. And so with the SI joint, weak is the joint that connects the tailbone with the pelvic bone, or whatever we can call it, it's an ally bone, we are seeing that there is a little tightness there. So what I'm going to go ahead and do actually is I'm going to adjust that area. So I'm going to use my activator. I'm going to adjust his pelvic. A little release the tension right in that little spot there. Very easy there. And then I'm going to want to adjust some of the other areas that were a little off here, because I remember we went through that. Just a little force. A little force. And what that does, it releases the tension in the vertebra there, bringing a correction in the vertebra there. We have another one right in there. Easy, easy. Any pain at all when I am adjusting?
No.
No pain. The patient says there's no pain when I'm adjusting. And I'm going to adjust the neck. Very easy, very easy. Aligns the vertebrae in the cervical. Because a lot of people think when you get adjustment, you are going to be in pain or whatever. But it's very simple. No pain. Stay there. Now, finally, I'm going to look at the length, and see how this is coming. So let's look at the length of the feet and see how they are coming. There we go. We are finalizing this adjustment. And all I'm going to do actually look at the length. And you can see the length of the feet are totally balanced. That's how simple this gets. The other thing is we're going to look at the way that the pelvic is. Lift this leg all the way for me. A little more. How is that? Pretty good? Mm-hmm. The other leg? How is that?
Good.
Pretty good? Mm-hmm. And you can see even the pelvic is balancing actually. And finally, I'm going to check the neck and see how the neck is feeling. Turn your neck to the right for me. Any pain? Mm-mm. To the left. Any pain? Mm-mm. No pain. Beautiful. That's how simple an adjustment can be. No pain, nothing crazy, nothing crazy. And the patient feels better. Come up. Thank you.